Hello, I'm Dr. Lisa Alvetro, and I'd like to thank LightForce for the opportunity to be part of beta testing, but I'd also like to thank them for the opportunity to share with you. We've had previous experience with product development and testing, so we're aware of the challenges and also the excitement. But working with LightForce was really a great experience for us because not only did they want my feedback, but they also wanted the feedback of my entire team. Not only did I work with one person, but an entire network of people within LightForce that were all so knowledgeable and also so excited about the product that they were developing. Now, for me, mixed dentition was so important because I try to do as many cases as I can in one face. There's exceptions. Maybe I'm correcting a crossbite, or maybe we need some arch development. But a lot of my cases, I'm starting right in that late mixed dentition. And what I was struggling with was, how do I use LightForce for them? Do I wait? But I want to create space now. Do I want them to miss out on the opportunity to have a customized bracket? Now I don't have to worry about that. Here's really a prime example. Someone who's just 13 years old, she really wants to get started. She could use some arch development, create some space or teeth, and have a path to erupt into attached tissue. Now, when you go to submit for your LightForce, you're going to have some choices in the beginning. You've got your comprehensive. Now you'll be able to pick, are you going to stage it? So there's going to be a few more choices that you're going to have on that initial setup, so they really know what your plan is. If you take a look at your setup, there's just a couple things I'd like to share with you. Obviously, once you have the brackets in place, then when you go to the final setup, you're going to see some teeth that are colored. The purple teeth are teeth that they put in there for you. The one that you see is slightly gray is one that's going to have a slight subgingival attachment. And then obviously we've got the Bolton analysis as well. So what are my options when I'm going to be adding brackets? Well, they can mirror the bracket from the opposite side, or you can create a second scan. So with that second scan, there's going to be a submission process, and you're going to be able to tell them which teeth you're going to be adding. Now, there's just a few things I'd like to share about that process. Now, the brackets that are part of the second stage will be active in the setup. You're going to see those in orange. The gray ones are ones that were moved previously, and you cannot manipulate those. Now, these brackets are going to be delivered in single tooth jigs because remember, the adjacent teeth will have already moved. Now, there's some recommendations. I would scan after all the teeth erupted. You want to avoid doing one and then the next. You really only want to do one additional scan. The one thing that's important is make sure that you're removing the wire. Even if maybe you're not adding any brackets in the lower arch, still remove both wires and still scan both arches. I think another exciting part of LightForce 2.0 is the ability to stage treatment. There's some patients where I'm going to want to start one arch before the other. I'm thinking about cases that are very deep, that I really want to start to open the bite. I want to do some transverse development before I start treating the lower arch. Sometimes these are people that have a history of joint problems, and they are just so deep it's even hard to determine where mandibular position is. It's someone that maybe is so deep that they're going to need bite turbos, but you're not real certain how they're going to tolerate them. This way we can start on the upper arch, and then we can add the lower arch once we have the clearance that we need to avoid bite turbos. And this is really a treatment plan for this young lady here, and here's her initial bonding. So, there really is a lot to get excited about when we're looking at LightForce 2.0.